Thank you for watching. We're so excited you're here to learn how to stay healthy during pregnancy. For more helpful tips and weekly videos, please subscribe and hit the bell icon to stay updated. Today, we're diving into diabetes in pregnancy, how to protect your baby's health. You'll discover what you need to know to keep you and your baby safe. Let's jump right in. Gestational diabetes, also called diabetes in pregnancy, happens when your body can't produce enough insulin to manage blood sugar levels. This usually occurs around 20 to 24 weeks of pregnancy. Hormones from the placenta, like human placental lactogen, make your body more resistant to insulin. This causes blood sugar to rise. Think of insulin as a key that unlocks sugar for energy, but during pregnancy, that key doesn't work as well. If not managed, gestational diabetes can lead to risks. These include a larger than average baby, known as macrosomia, premature birth, or preeclampsia. Preeclampsia is high blood pressure that can be serious for you and your baby. The good news? With early action, you can manage gestational diabetes. According to the American Diabetes Association, most women control it with diet, exercise, and sometimes medication. Let's explore what gestational diabetes looks like and how you can spot it. Some signs of gestational diabetes might feel like normal pregnancy discomforts, but they shouldn't be ignored. You might feel thirstier than usual, even after drinking plenty of water. This happens because high blood sugar makes your body flush out sugar through urine. This dehydrates you, so you're reaching for water all day, maybe even at night. Another sign is frequent urination. High blood sugar makes your kidneys work harder, leading to more bathroom trips. Pregnancy already increases urination, but waking up multiple times at night to pee is a red flag. Fatigue is also common. If you're exhausted despite resting, it could be because your body isn't using sugar effectively for energy. Blurred vision might happen too. High blood sugar can affect the fluid in your eyes' lenses, making things look fuzzy. Lastly, genital itching or frequent infections like yeast infections can occur. High blood sugar creates an environment where bacteria thrive. So, what should you do if you notice these gestational diabetes symptoms? First, talk to your doctor right away. If you spot signs like thirst or fatigue, they'll likely recommend a gestational diabetes test, usually between 24 and 28 weeks. This test involves drinking a sugary solution, and they check your blood sugar after an hour or two. Keep a journal of your symptoms or habits. Note how often you're thirsty or what you're eating to share with your doctor. This helps with a better diagnosis. You can also start healthy habits now to manage pregnancy diabetes risks. Let's talk about how to do that, especially with diet and lifestyle changes. Eating for gestational diabetes means choosing low glycemic foods to keep blood sugar stable. These include whole grains, vegetables, and lean proteins. Swap white bread for whole grain bread or sugary snacks for berries. A sample breakfast could be oatmeal with almonds and a sliced apple. This keeps you full and your blood sugar steady. For lunch, try a salad with grilled chicken, avocado, and quinoa. Dinner could be baked salmon with steamed broccoli and sweet potato. Aim for smaller, balanced meals every few hours to avoid blood sugar spikes. Snacks like Greek yogurt with nuts or hummus with veggies are great choices. Avoid sugary drinks like soda or juice. Stick to water or unsweetened teas to stay hydrated. These gestational diabetes diet tips are simple but powerful for keeping you and your baby healthy. Exercise is another key way to manage diabetes in pregnancy. Walking for 20 minutes a day or doing prenatal yoga can help your body use insulin better. These activities are safe for most pregnant women, but always check with your doctor first. Staying active doesn't mean intense workouts. Even light stretching or a leisurely stroll can make a difference. Pair this with good sleep and stress management. High stress can raise blood sugar, so try deep breathing or meditation for a few minutes daily. These small changes add up and help lower pregnancy diabetes risks. Let's bring this to life with a story. Meet Emma, a 30-year-old mom in her second trimester. She noticed she was thirstier than usual and thought it was just pregnancy. But when she started waking up 3 times a night to pee and felt exhausted, she told her doctor. They ordered a gestational diabetes test, and Emma was diagnosed with gestational diabetes. She worked with her doctor to eat low glycemic meals. She chose quinoa with veggies and grilled chicken and walked daily. Emma also kept a symptom journal, which helped her doctor adjust her plan. By delivery, her baby was healthy at 7 pounds, and her blood sugar was under control. Emma's story shows that taking action early can make a big difference. You can take charge of your health too. Now, let's talk about the gestational diabetes test in more detail. The glucose screening test is simple and usually done between 24 and 28 weeks. You drink a sweet solution, and your doctor checks your blood sugar after an hour. If the results are high, you might need a follow-up test called the glucose tolerance test. This one takes longer, about 3 hours, and involves fasting beforehand. Don't worry, it sounds scarier than it is. The test helps confirm if you have gestational diabetes so you can start managing it. If you're at higher risk, maybe you have a family history of diabetes, are overweight, or had gestational diabetes before, your doctor might test you earlier, around 12 to 16 weeks. Knowing early means you can act fast to protect your baby's health. What are the risks if gestational diabetes isn't managed? For your baby, high blood sugar can lead to macrosomia, where they grow larger than average. This can make delivery harder and increase the chance of needing a C-section. Babies born to moms with uncontrolled gestational diabetes might also have low blood sugar at birth or breathing problems. For you, there's a higher chance of preeclampsia, which can cause swelling, headaches, and high blood pressure. Long-term, gestational diabetes raises your risk of type 2 diabetes later in life. But here's the hopeful part. Managing it well reduces these risks. Most women with gestational diabetes have healthy babies and recover fully after birth. Sometimes, diet and exercise aren't enough, and that's okay. Your doctor might prescribe insulin or oral medications to keep your blood sugar in check. These are safe for pregnancy and tailored to your needs. Regular blood sugar checks at home with a glucometer might also be part of your routine. It's like a quick finger prick to see where your levels are. Your doctor will guide you on how often to check and what numbers to aim for. This might sound overwhelming, but it becomes a simple habit, like brushing your teeth. You're doing it to keep your baby safe, and that's worth it. Let's address a common worry. Will gestational diabetes affect my baby forever? In most cases, no. When managed well, your baby is likely to be born healthy with no long-term effects. After birth, your blood sugar usually returns to normal, though you'll want to keep an eye on it. Your doctor might check your blood sugar a few months after delivery to be sure. About 50% of women with gestational diabetes develop type 2 diabetes later, so staying active and eating well post-pregnancy is a smart move. Think of this as a chance to build lifelong healthy habits for you and your family. Here's a quick recap of actionable steps for diabetes in pregnancy, how to protect your baby's health. First, know the signs: thirst, frequent urination, fatigue, blurred vision, or infections. Second, get tested, especially between 24 and 28 weeks, or earlier if you're at risk. Third, eat a gestational diabetes diet with low glycemic foods like whole grains, veggies, and lean proteins. Fourth, stay active with safe exercises like walking or prenatal yoga. Fifth, keep stress low and stay hydrated. Finally, work closely with your doctor for tests, monitoring, or medications if needed. These steps empower you to take control and protect your baby's health. We're here to make this journey easier with clear, mom-friendly advice. Gestational diabetes can feel scary, but you're not alone. Millions of women manage it every year and have healthy pregnancies. You've got this. Let's share one more story to inspire you. Sarah, a 28-year-old first-time mom, was diagnosed at 26 weeks. She was nervous but followed her doctor's advice. She ate balanced meals, walked after dinner, and checked her blood sugar daily. By her third trimester, her levels were stable, and she felt confident. Her baby girl was born healthy, and Sarah now shares her tips with other moms. You can follow her lead and make small changes for big results. To wrap up, today we covered diabetes in pregnancy, how to protect your baby's health. You learned how to spot gestational diabetes symptoms, manage it with a gestational diabetes diet, and lower pregnancy diabetes risks. We also talked about the gestational diabetes test and why early action matters. We're here to empower you with reliable advice for a healthy pregnancy. Comment below. Have you noticed any symptoms or tried these tips? Let us know. Subscribe for more videos on gestational diabetes symptoms, diet, and tips. Check out our playlist on gestational diabetes management for more ideas. Always consult your healthcare provider for personalized medical advice. Thanks for watching and see you in the next video.